Hi guys, this is Dr. El Sharif, or as many of you know me as Dr. Dana, Dr. D, or Dr. El Sharif. I'm here to answer your questions and address your concerns. I received emails from some of you asking actually very similar questions. Some of the questions are, there's a cure for COVID-19. What can I do to prevent myself from getting the infection? If I take vitamin C, is it gonna help protect me? There was a question about Acetozoamide, a medication used for high-altitude pulmonary edema for the treatment of that. So the question is regarding a YouTube video talking about this medication as a possible cure for COVID-19. So what they were saying in the video, symptoms related to high-altitude pulmonary edema include shortness of breath, cough, fever, dizziness. Symptoms of COVID-19, some of the symptoms are cough, most common symptoms, cough, fever, shortness of breath, and dizziness. So they share similar symptoms. They have something in common here. And therefore, they're saying that if this medication have worked for patients with high altitude pulmonary edema, then it should also work as a cure, a possible cure for COVID-19. Let's keep in mind that the cause of COVID-19 is totally different than the actual cause of the symptoms related to high-altitude pulmonary edema. In the case of COVID-19, we have a virus attacking the lung. It's a virus. We know what's causing the symptoms. In the case of high-altitude motion sickness, it has to do, the symptoms are related to the high altitude. So we have two different causes. Now, can that medication help relieve some of the symptoms experienced as a result of being infected from COVID-19? Possibly, yes. But is it the cure? It's not the cure. So far, we do not have a definite answer. Another question, vitamin C. If I take vitamin C, will it protect me from being infected with COVID-19? And the answer is no. But vitamin C does help. I do recommend my patients to take vitamin C, but for a different reason, not because it is the cure for COVID-19 or it will for sure prevent COVID-19, but because to have a good immune system, you actually do need vitamin C. Vitamin C deficiency will actually lead to a weak immune system. And if you were to get infected, you become more vulnerable and you're a higher risk patient if you have low immunity. So vitamin C help with the immune system, and that's why I say take vitamin C, but it doesn't mean it's the cure for COVID-19. Our question has to do with the medication. Will you please send me a script for hydrochloroquine and azithromycin? Some people think that if they take the combination of medication without any indication, they're going to be protected. It will protect them from the actual infection. The answers to many of these questions is no. We still don't have any proven data or studies about a definite cure for COVID-19, but there are certain things that we can do to prevent it from spreading further and to protect ourselves. So preventive measures pretty much is the answer for now, and some of these measures are washing your hands, washing your hands, washing your hands. Social distancing, it's very important. Wearing masks, actually 4 out of 5 infected patients do not have symptoms of COVID-19 and they think that they're healthy. They're the one who are going out and about and spreading the virus. Just because they don't have symptoms, they think that they're not at risk. And they're actually giving it to the vulnerable patients. Vulnerable patients, that includes anyone the age of 65 or older, anyone with a chronic condition such as chronic kidney disease, liver disease, diabetes, high blood pressure, any pulmonary issues or problems. Smokers are at high risk. Immunocompromised patients, patients with an autoimmune disease. We have to be careful, guys. We have to be careful. Wearing gloves sometimes actually can make matters worse. So you'll say I'm wearing gloves and I'm touching that surface that has COVID-19 on it. Now that COVID-19 is on the surface of my gloves and I sneeze, I touch my face. Whoops, it splits my mouth. Now I'm infected. Simple as that. Just use the comment box below to ask me questions or to put your comments in there. And I will hopefully see you very soon with a different topic. Stay safe and don't forget to wash your hands.